Dr. Marcus Johnson had filled thousands of prescriptions in his career as head pharmacist, but he'd never been accused of prescription fraud while trying to pick up his own medication. When technician Sarah Mitchell decided his prescription looked suspicious, she had no idea she was questioning her own boss.
Don't forget to subscribe, leave a like, and a comment before we start to learn more about what happened.
Metropolitan General Hospital's main pharmacy operated 24 hours a day, serving not only the hospital's patients, but also providing prescription services to hospital employees and their families. The spacious facility featured modern dispensing systems, climate-controlled storage, and a team of skilled pharmacists and technicians who processed over 3,000 prescriptions daily. Dr. Marcus Johnson had served as the hospital's head pharmacist for 7 years, building a reputation for clinical excellence, staff development, and patient safety initiatives that had earned the pharmacy national recognition. At 39, Marcus was respected throughout the medical center for his expertise in medication management and his commitment to mentoring young pharmacy professionals. On this particular Friday evening, Marcus wasn't at the pharmacy in his professional capacity. He was there as a patient, picking up a prescription for antibiotics that his family physician had prescribed for a stubborn sinus infection that had kept him home from work for 2 days. Marcus approached the pharmacy counter at 6:45 p.m., dressed in jeans, a casual polo shirt, and sneakers. Without his white coat and professional attire, he looked like any other patient seeking prescription services. In his hand, he carried a prescription written by Dr. Jennifer Walsh, his longtime family physician, for a 10-day course of amoxicillin. Sarah Mitchell, a 25-year-old pharmacy technician, had been working at Metropolitan General for 18 months. She took pride in her attention to detail and her ability to identify potentially problematic prescriptions. Sarah had been trained to watch for signs of prescription fraud, drug-seeking behavior, and suspicious patterns that might indicate abuse or diversion. When Marcus approached her window, Sarah immediately began her standard assessment. She noted that he was a black man in casual clothes, presenting a prescription for antibiotics during evening hours when many fraudulent prescriptions typically appeared. Her training had taught her to be especially vigilant during off-peak hours when oversight might be reduced. "Good evening," Marcus said politely, sliding the prescription across the counter. "I'd like to fill this, please." Sarah took the prescription and began examining it with unusual scrutiny. The paper looked legitimate, but something about the situation triggered her suspicions. The handwriting was neat, perhaps too neat. The patient's address matched the prescription header, but the prescribing physician's name wasn't immediately familiar to her. "Mr. Johnson," Sarah said, reading the name from the prescription, "I need to ask you a few questions about this medication." Marcus looked slightly puzzled, but remained patient. "Of course. What is this medication for?" "Sinus infection," Marcus replied. "Dr. Walsh prescribed it yesterday." Sarah continued her questioning. "Have you taken amoxicillin before?" "Yes, several times over the years." "Any allergies to antibiotics?" "No, no allergies." Sarah studied the prescription again, looking for irregularities. The prescription was perfectly written, with appropriate dosing, proper DEA numbers, and all required elements. But her instincts told her something wasn't right. "Mr. Johnson, this prescription seems unusual to me. The handwriting is very neat, almost too perfect." Marcus raised an eyebrow. "I'm sorry, what do you mean by too perfect?" "Legitimate prescriptions often have more variation in handwriting. This looks like someone was being very careful to make it look official." Marcus began to realize what was happening but maintained his calm demeanor. "Are you suggesting this prescription isn't legitimate?" "I'm not suggesting anything," Sarah replied defensively. "I'm just being thorough. It's my job to identify potential prescription fraud." "I understand you're being careful, but this is a straightforward antibiotic prescription from my family doctor. Sarah picked up the phone. I'm going to need to call Dr. Walsh's office to verify this prescription. Her office closed at 5, Marcus noted. You won't reach anyone until Monday. Then you'll have to wait until Monday to fill this prescription. Marcus looked at Sarah with growing concern. You're refusing to fill a legitimate prescription for antibiotics because you can't reach the doctor's office on a Friday evening. Mr. Johnson, I have reason to believe this prescription may be fraudulent. What reason, specifically? Sarah struggled to articulate her suspicions without revealing their discriminatory basis. The circumstances are suspicious. You're presenting this prescription during off hours. You're not a familiar patient. And the prescription has characteristics consistent with fraudulent documents. What characteristics? The handwriting, the timing, and... Sarah trailed off, realizing she was about to reveal the racial profiling underlying her suspicions. And what? Marcus prompted. Sarah decided to take a different approach. Mr. Johnson, I need to see additional identification beyond your driver's license. Marcus pulled out his wallet and provided his health insurance card and a credit card. Sarah examined the IDs but wasn't satisfied. Do you have anything that shows your current address? My driver's license shows my current address. I need something more recent, a utility bill or bank statement. Marcus felt his patience beginning to thin. I don't carry utility bills in my wallet. Is there a specific policy requiring additional documentation for antibiotic prescriptions? Sarah realized she was making up requirements as she went along. It's standard procedure for prescriptions that raise red flags. What red flags are you seeing in a prescription for amoxicillin? Before Sarah could answer, Dr. Lisa Chen, the evening shift supervisor, approached the counter. She had been observing the interaction from across the pharmacy and sensed escalating tension. Is there a problem here? Dr. Chen asked. Sarah turned to her supervisor with relief. Dr. Chen, I have concerns about this prescription. The patient is requesting amoxicillin, but the circumstances seem suspicious. Dr. Chen looked at the prescription, then at Marcus. What seems suspicious about it? The handwriting is too neat. He's presenting it during off hours, and he doesn't have adequate identification. Dr. Chen examined Marcus's driver's license and insurance card. Mr. Johnson, what seems to be the problem? Your technician is refusing to fill a legitimate prescription because she believes it's fraudulent, though she can't articulate any specific reasons for her suspicion. Dr. Chen looked more closely at the prescription. Sarah, this prescription appears completely legitimate. Dr. Walsh is a well-known family physician. The DEA numbers are correct, and this is a standard antibiotic dosing. But Dr. Chen, something doesn't feel right about this. Dr. Chen studied Sarah's face, beginning to understand the real nature of her concerns. Sarah, can you step into my office for a moment? As the two women walked away, Marcus remained at the counter, frustrated by the delay but curious to see how the situation would resolve. In Dr. Chen's office, the conversation was direct. Sarah, what specifically makes you think this prescription is fraudulent? Sarah struggled to explain. It's just a feeling I have. The patient seems not like our usual customers. Not like our usual customers, how? Sarah realized she was walking into dangerous territory. I don't know, just different. Dr. Chen pressed further. Sarah, are you basing your suspicions on the patient's race? No, Sarah protested. It's not about race, it's about the prescription itself. Then explain to me what's wrong with the prescription. Sarah couldn't provide a coherent answer. It just seems suspicious. Dr. Chen returned to the pharmacy counter where Marcus was waiting patiently. Mr. Johnson, I apologize for the delay. We'll have your prescription ready in about 10 minutes. Thank you, Marcus replied. I appreciate your professionalism." As Dr. Chen began processing the prescription, Sarah returned to the counter with a sullen expression. "Sarah," Marcus said gently, "can I ask you something?" Sarah looked at him warily. "What? In your 18 months working here, how many prescriptions have you flagged as potentially fraudulent?" Sarah was surprised by the specific knowledge of her employment history. "I don't know exactly." "How many of those involved black patients?" Sarah's face flushed as she realized the implication of the question. Marcus continued calmly. "I'm curious because prescription fraud occurs across all demographic groups, but implicit bias often affects which patients get questioned." "I don't know what you're implying," Sarah said defensively. Dr. Chen returned with the filled prescription. "Mr. Johnson, your medication is ready." As Marcus reached for the prescription bag, he pulled out his hospital ID badge. "Dr. Marcus Johnson, Pharm D, Head of Pharmacy Services, Metropolitan General Hospital." Sarah stared at the badge in shock. Dr. Chen's face showed recognition and embarrassment. "Dr. Johnson," Dr. Chen said quickly, "I am so sorry. I didn't recognize you without your coat." Marcus looked at Sarah, whose face had gone completely white. "Sarah, I want you to understand what just happened here. You accused your boss of prescription fraud based on nothing more than racial bias and unfounded suspicions." Sarah's mouth opened, but no words came out. "More importantly," Marcus continued, "you demonstrated the kind of discriminatory behavior that affects patient care and creates barriers to healthcare access for minority patients." Dr. Chen stepped forward. "Dr. Johnson, this is completely unacceptable. I will be filing a formal incident report and—" Marcus held up his hand. "Dr. Chen, I appreciate your concern, but I'd like to handle this as a learning opportunity." He turned back to Sarah. "Sarah, I want you to think carefully about what happened tonight. You saw a black man presenting a prescription and immediately assumed something was wrong. You couldn't articulate any specific concerns, but you were convinced fraud was involved." Sarah nodded miserably. "Dr. Johnson, I'm so sorry. I didn't know who you were." "That's exactly the point," Marcus replied. "Your treatment of patients shouldn't depend on knowing who they are. Every patient deserves the same level of respect and professional service." Marcus opened his prescription bag and showed Sarah the label. "This is a standard antibiotic prescription written by a physician I've seen for 15 years. There was nothing suspicious about it except your assumption that a black man couldn't legitimately need medication." Sarah began to cry softly. "I realize I made a terrible mistake." "Sarah, the mistake wasn't just about me. It was about every black patient who might face similar scrutiny when they're seeking legitimate medical care." Dr. Chen spoke up. "Dr. Johnson, what do you recommend we do about this incident?" Marcus considered the question. "I recommend comprehensive bias training for all pharmacy staff. I also recommend reviewing our policies to ensure they're applied consistently, regardless of patient demographics." He looked at Sarah. "And I recommend that Sarah spend some time thinking about how her assumptions might affect patient care." Over the following weeks, Marcus implemented a pharmacy-wide training program on implicit bias and cultural competency. Sarah participated actively in the training and became an advocate for equitable patient treatment. The incident became a case study used throughout the hospital system to educate staff about the impact of unconscious bias on patient care. Marcus continued to get his prescriptions filled at the hospital pharmacy, often stopping to chat with staff about their experiences and challenges in providing equitable care to all patients. And Sarah Mitchell became one of the pharmacy's most thoughtful and inclusive staff members, using her experience to help train new employees about the importance of treating every patient with dignity and respect. Because sometimes The most important prescriptions are the ones that cure bias, prejudice, and the assumption that people are not who they appear to be.